Claudia Baron was always unhappy with her smile. Multiple diastemas were the most noticeable, but she also desired a whiter shade of teeth. She longed for a uniform smile. When she discovered Lumineers, she knew they were the answer to a beautiful new smile. Upon completing Claudia's smile evaluation, observations included multiple diastemas, uneven incisal edges, and mild discoloration. Her intraoral evaluation concluded adequate candidacy for the procedure with normal temporomandibular condition, no traumatic incisal relationships, and a good standing of periodontal health. Determined by the width of her smile, Claudia's treatment plan included the placement of 8 Lumineers. She chose the shade B1 for uniform whitening, and no cosmetic contouring was necessary. Claudia is excited for her transformation to a bright and seamless Lumineers smile.
So let's take a look at Jessica's layout here. And Jessica has placed 2 solutions on those Lumineers. One is she's placed on the porcelain conditioner, and the other she's put the Serenade Prime on. In addition to that, she has also polished the teeth with the porcelain polishing paste, and that's to get rid of the plaque on the teeth. So let's get started, and the first thing we're going to do is put some paint on dental dam on the lingual side of the patient's maxillary teeth. And the purpose of the paint on dental dam is it makes cleanup easy. Now, one of the things you have to be careful with is when a patient has diastemas, you don't want the paint on dental dam to come through to the labial surface, or you may not allow the Lumineer to seat all the way. Close your eyes. See that now? So now we're going to do surface treatment. What I'm using is Etch and Seal, and Etch and Seal contains aluminum oxalate. If I put it on dentin, by having the aluminum oxalate, I can seal the tubules. Wash that off. What I'm applying to the teeth now is tenure AB. Tenure AB because it's not light dependent. That means no matter what you put on it, it's going to polymerize with any composite you place there. So I use it for more than just Lumineers. Now we've completed surface treatment on the enamel. And Tenure S is a resin that will cause all of your resin to polymerize. It also protects that treated surface from contamination. And I just blow the excess off. Left central, and I want to see excess going everywhere.
Right lateral.
Right lateral. Here we go. Left cuspid.
Left cuspid. Right cuspid.
Then let's go on to the right first bicuspid too then. And once I place this, then all the margins get filled in with the Ultrabond. Now what you want to think about is that the restorative is not the Lumineer. The restorative is the Ultrabond between the Lumineer and the tooth. That's how you're going to get sealed aesthetic margins. And what I like to do there is gently hold it in place, see excess coming, and close your eyes. Your eyes. Okay. Place the bicuspid. Close your eyes. And close your eyes. I always see excess come out before I push the button. Okay, now I have spot cured these on the teeth. Now let's take a look at what we got on the lingual side here so we can show everybody what I'm taking off. And then I'll come back. Close your eyes. Close your eyes. And I'm using a Sure 349 to remove this. And you can see this coming off here. Then our next step is to remove the paint on dental dam. Now let's let everybody take a look and see what those gingival areas look like. So now what we have to do is clean up. And I'm using a Sure 349 instrument because it won't scratch the glazed porcelain. Now we'll start out by taking a football-shaped diamond. And you always want to use a lot of water, because if you place diamond instruments or any instruments on porcelain and you don't have it water cooled, there's a good chance you'll cause stress fractures. And because I have magnification, it's just like I'm 2 inches from the surface of the tooth. And I'm going back. Once you get a little water on here, a lot of the ultrabond pops off. Now I'm using a 12-fluted burr. Now the reason I like to use a 12-fluted burr is it will follow the outline of the tooth and it won't cut the porcelain. All of these pieces of finishing that I'm using, they're included in a Lumineers finishing kit. Now I come back with the ultrafine needle nose diamond, and now I'm taking that shoulder and blending it in with the natural teeth. Now the secret to opening these contacts is to take your time with magnification and removing all of the excess. Now we'll take a long, narrow diamond. Now I just want to go on the lingual side and open these embrasures. I want to get these embrasures open so when I come through with my seri saw, I'll have a pathway to follow. So let's decide how we're going to open these contacts. So what I'm going to do is just stop sawing and I start rocking when it gets a little bit tight in there. And I do it very gently, and then I come back out. And I just saw halfway through, and then I rock down the rest of the way. So all the contacts are open. Now we'll take a seri sander. It looks like a seri saw. It's got diamonds on one side. And then I just go through. I tell patients, I say, you know, you may not realize it, but this is the fine finishing part. But we have another very important step before we let the patient leave, and that's adjusting the occlusion. Close. And if you got a little ultrabond in there, it shows up on the marking paper, identifies it. Marks on natural teeth, a little bit in the embrasure in there. Marks on natural teeth. I'm going to have to look at this area right here rather closely because it's coming off on the porcelain. I could chip it. Got to look out for this area. One of the places that I encourage you to watch out for is the distal of the laterals and the mesial of the cuspids. Because when I have fractures, it's because I inadvertently let the patient go home with unprotected occlusion in that area. When the patient goes into protrusive, they knock it off. Okay, so we'll take our football-shaped diamond. I want to protect the porcelain by letting the natural tooth be the protector of it. Okay, let's take another look here and see what we got. Open. Now close. Anyhow, these are pretty good marks that we have in here. This is a spot we might want to watch just a little bit right here on that lower central. Okay, here you go. I'll hold this over here.
Oh, wow.
Can you imagine that change?
I was not satisfied with my smile because I had a lot of spaces in between, and I was very embarrassed to smile and show my teeth, so I would just try to grin instead of smiling. Oh, my friends and family, they love my Lumineers. They love my smile now. They just compliment my teeth. Oh, yes, I would recommend Lumineers to everybody.